Veterinary medicine is a messy business, both physically and emotionally. Vetsplaining is one veterinarian's attempt to explain and understand her own profession a little better. Join Dr. Lisa McFaddin as she delves deep into the medical and business aspects of veterinary medicine. Welcome back, guys. I missed you. We missed last week because I had some sort of funk that my child shared with me from daycare, and I figured you didn't want to listen to me cough for 20 minutes. So we're back, and you may hear some odd pausing. I still have a little bit of a cough, and I'll try and pause it and cough and then start again. So today we're going to talk about ears, and we're going to talk about ears in cats and dogs, and we're going to focus on the outer ear canal, and that's where most of our issues arise. And we can definitely talk in a separate podcast about the middle and inner ear, because there's a lot of interesting things and signs and symptoms that can happen if there's a middle or inner ear infection. But today we're going to talk about the outer ear. So there's differences in anatomy between cat and dog ears, in part because of the size, also in part because of the ear conformation. So that flap, whether it stands straight up, as in most cats, unless you're Scottish fold, or it points down for like a lot of your beagley dogs, that ear flap is basically a sandwich of skin, cartilage skin, and it's called the pinna, P-I-N-N-A. The shape of the pinna helps to funnel in sound waves to increase their ability to hear. In the case of floppy-eared dogs, those are usually dogs that are involved in hunting, or their jobs originally were to like go under brush or go into holes, kind of like Jack Russell Terriers. They were supposed to go into holes and like retrieve badgers and other wildlife that live in like little burrows. And so you want to have that flap down to protect the inside of the ear from external injury or from getting a lot of dirt and debris in there. So you have the pinna, and like we said, the main goal in dogs with erect or straight up ears is to funnel sound. In dogs with floppy ears, it is to protect them. In Scottish folds, I believe it's mostly just for show, like it's just a cosmetic appeal that people had. One other thing to mention about cat ears is if you've ever looked at a kitty ear, on the outside margin, there's like this extra little pocket. It's actually called Henry's pocket, and nobody knows the exact reason that it's there, kind of like nobody knows the exact way that cats purr and or the exact reason that cats purr. So I thought when I went to vet school, like there were certain things I would find out, and then I was a little disappointed to learn that we just don't know the answer. So, 4 years later, I thought, oh man, I still never learned. So that Henry's pocket, and honestly, I don't know who Henry was. I feel like they should have used their last name, but that's okay. So Henry's pocket, we think, is like an extra mechanism to help funnel different frequency sounds. And cats have much more mobility of their ears, like they can almost turn them 180 degrees around. They can't, but they have really good range of motion to let them, and they can move independently to let them hear different sounds. Dogs, to a certain extent, can kind of move their pinnas a little bit, but not as much as cats. So in people, our ear canal is like a straight shot. So, you see the opening, and then if you use an otoscope, which is the fancy term for the apparatus that has light and a slight magnification to look, you can see directly straight ahead the eardrum. In cats and dogs, they have an L-shaped canal. So the long vertical portion of the L is called the vertical canal, and then the shorter horizontal portion is called the horizontal canal, and that helps to funnel sound, but it also helps to protect it. And so just keep in mind, like the distance between the outside of your cat or dog's ear and then the inner eardrum is different. I mean, in cats, it's probably, because they're smaller, like if you straighten it out, it's probably about the same length. But in dogs, especially like, your 150-pound mastiffs, like that's a big canal. And the opening, like the actual diameter of the canal, is a lot bigger than in people. And it is species dependent. So in humans, at least, it's relatively comparable from person to person. But in animals, it's a ginormous difference. And so when we examine ears, what we need to do is we need to examine the outside haired portion of the pinna, the inside hairless portion of the pinna, and then the outer external canal. Okay, so that's what you first see when you look below the pinna. And that's where all like the whorls of cartilage are. And then you need to use an otoscope that has a long head attachment. You know, when you go to the doctor, they have those like short, stubby head attachments. Again, because we're dealing with a longer canal, you need to use a long attachment to look deep into the ear. And what you'll see me do is I use their pinna kind of as like a handle. So I hold it and then I pull it slightly, like I'll have my assistant hold the head. And then I hold the pinna and I pull it slightly down and out just to help kind of straighten out that L a little bit. And when you look in the ear with the otoscope, you have to go down and then you have to angle in. And you always want to be able to see the eardrum to make sure that, you know, in that canal, there's no growth. So there's not a lot of debris, whether it's wax. Some, especially like poodles, will have a lot of hair in the inside of the ear coming from the vertical canal and the external canal. And then most dogs will have like this little tuft of hair. You know, it's not very many. I've never counted because, you know, I would not be able to look long enough in an awake animal to count. But they have like this little tuft of hair right in front of the eardrum. And when you look at the eardrum, it's supposed to kind of look like this, like opalescent, thin sheet of like saran wrap that is not completely translucent. And that is a nice, healthy eardrum. And if it's discolored, if it's missing in part, then that all indicates damage to the eardrum, which usually indicates that there's middle ear involvement. So then your middle ear is basically your eardrum, and then there's these small air fluid chambers that have those three little bones that we learned about called the hammer, the anvil, and the stirrup. And there's also two muscles in that area called the oval window and the eustachian tube. And the eustachian tube helps connect the middle ear with the back of the nose that lets air go into the middle ear. And then the inner ear is like this whole other complex structure that includes the cochlea, which is what we hear with, the vestibular system in part, which is one of our organs for balance. The general rule of thumb is if there is an external ear infection, okay, so the outer canal, so the pinna, the external canal, the vertical and the horizontal canal, then that is a topical treatment. If it is a middle or inner ear infection, then that requires oral antibiotics or oral antifungals. That's very uncommon. It's generally bacterial infections that affect the middle and inner ear. So the next question is, why do dogs get ear infections? Well, there's a lot of reasons. And in people, you know, we get earwax because that is one protective mechanism to help keep our ear canal clean. And the same thing is true in cats and dogs. So the normal kind of mechanism is, you know, the ear canals, the cells that line the ear canals produce this like ceruminous or waxy discharge that is supposed to protect the epithelial or skin surface of the inside of the ear that limits the ability of bacteria and yeast to kind of colonize in there. And what's supposed to happen is, you know, it makes a little bit of wax and then cells start to slough and then everything kind of moves from the inside of the ear out. And that is like the normal mechanism of action. And if something like allergies or water or trauma occur, then that interferes with the normal kind of clearance mechanism, and that can result in an ear infection. Sometimes ear infections can be caused by like a genetic predisposition to create too much earwax, and Cavaliers kind of fall into that realm. They make a lot of earwax in general, and Sphinxes can sometimes make excessive amounts of earwax. And cats actually get this thing. Dogs don't get it as much, but they get these like ceruminous growths. They look like little black, almost like giant blackheads, but they don't pop. They're basically just like chronically irritated areas of the ear where a lot of wax and debris has been produced and a lot of infection has occurred, and it happens over time. But the problem is that any time you get a growth or a swelling in the ear, again, that affects its normal clearance mechanism, which leads, unfortunately, to more infections. So excessive earwax can lead to infections because the wax can't clear out like it normally should, and so it just kind of sits and festers. And anything that's moist and damp is just a great breeding ground for bacteria and or yeast. And other potential causes would be like dogs that have naturally hairy ears, poodles, golden doodles. A lot of times, any of those like really excessively furry dogs or dogs that have more hair than fur. And that hair has a protective function as well as a auditory function, but it can sometimes interfere with the ability of that wax to do its job, and it can accumulate moisture. And so in really hairy dogs, a lot of times we will actually have to pluck the hair or shave it to shorten it to let us clean the ear better. I am not a huge proponent of plucking ears unless you need to, because I sometimes think that the irritation and inflammation caused by plucking can result in further problems. I have a similar philosophy about anal glands, like don't express them just to express them, but if there's an issue, express them, just because I feel like once you kind of start down that path of plucking or expressing anal glands, even though they're two totally separate issues, you end up getting into this cycle of like if you don't do it, then it becomes a bigger problem. So ear infections in dogs can be either bacterial or yeast or both. And most people present to the veterinary clinic because their animals shaking their head. Like a lot of times clients bring their dogs in because dogs wear collars all the time, and those little tags that they accumulate when they shake their head jingle, and it gets really annoying. Sometimes they can have their head kind of cocked at an odd angle. In that instance, we have to find out if it's just because the ear's bothering them versus there's a middle or inner ear infection that's actually causing their body to be confused as far as like what is normal up and down. And scratching a lot at the ear is another possible cause. Or sometimes people will note that they went to pet their dog's head and they yelped. And that could be if there is a significant ear infection and there's significant inflammation causing pain. In cats, they'll be itchy. They may hold their head a little strange. They may actually hold their ear kind of low to one side, and they may resent you touching the ear, or they may be like overly sensitive if you pet them. Cats don't usually yelp. They usually grumble and then try and swat, just because they're a little more direct in their annoyance. So you take them to the veterinarian. The veterinarian is going to examine the external and internal portion of the ear. Again, we can't evaluate the middle ear if that eardrum is intact, but we always want to make sure it's intact, because a lot of the medications that we use, if that eardrum is not intact, are irritating to the systems in the middle ear and can make them sick and can be uncomfortable and potentially even lead to hearing loss. So we check the ear, we take swabs, so we take a Q-tip, we get a sample of each, we put it on a slide, and then what we do is we heat fix it. So that basically means we take on the opposite part of the slide, we hold it horizontally, and we run a flame under it. And what that does is it melts the wax, because if you just try and stain a waxy ear slide, that wax is not going to let you take up very much stain, and it's going to be very hard to see under the microscope. So we melt the wax, or we do what's called heat fixing. Then we stain it in what's called a diff quick stain, which is like a blue, pink, purple. And then we rinse it, and then we dry it, and we look at it under the microscope. And we look at it under low and high power, and that lets us see, like, are there white blood cells? Are there a lot of wax? Are there a lot of bacteria? Are there a lot of yeast? What kind of bacteria? So when we say what kind of bacteria, we can't identify the bacteria just under the microscope. In order to identify the exact type, you have to actually culture it or grow it. But we can tell you, are they cocci, which look like little balls? Are they rods, which look like rods? And rods tend to be a more intense infection, and the presence of rods frequently is an indicator that we should culture it. And the reason we may recommend an ear culture, like in dogs that have chronic ear infections, is because bacteria can become resistant. And if you are continuously using an antibiotic that the bacteria is resistant to, it's like you're banging your head against a wall. You're not going to help them. And if you keep changing antibiotics, then you're just going to create resistance. So we look at it under the microscope. We use a grading scale. I use like a 0 to 4+, which, whenever people are starting to look under the microscope, it's like they want to count each individual one. And that's not wrong. I mean, I think it's great if you have the the patience to sit there and count every little dot or yeast that you see. And yeast, just for people who are interested, either look like, some people call them peanuts, some people call them footprints under the microscope, and those are budding yeast. Sometimes you can have really big circles, which are the non-budding